And now we're joined by Dr. Masanti Levine, who is joining us to talk about symptoms and calming fears over coronavirus, which is very important, Dr. Levine. And so first of all, I want to ask you, as a health professional, have you seen viruses like this before with patients?
Well, not really. I mean, we have these outbreaks periodically. We deal with the flu virus every year about the winter time, but certainly these outbreaks are not as common as the flu outbreak that we see typically each year. So we don't see it every year, but certainly we will continue to see some of these outbreaks over the years, of mankind.
And so what are the symptoms like for coronavirus? They may differ from other things like the flu.
Yeah, so it is a virus, so we will see the cough, we will see the low-grade fever, the chest congestion, shortness of breath. Sometimes it can create some gastrointestinal issues, such as diarrhea, abdominal pain, or nausea. But, the fever and cough and then shortness of breath, achiness are some of those typical viral symptoms that we see.
And so, of course, we don't want to scare people, okay? But what are some of the precautions that people should take if they have fears about traveling and going to places where there are a lot of people? What should they do?
Well, this is an evolving issue. We're learning new things every single day. The CDC website is a great resource for a lot of patients, even physicians like myself, because it is new and all of the specialists out there are learning every day. So that's a great website to go to look for hints about whether or not they should travel or not travel or stay quarantined, etc. These are some of the things that are being brought up each and every day.
Gotcha. And when do you know to go to the doctor? Just because you have a lingering cough or just because you have some other symptom doesn't necessarily mean you have coronavirus.
Yeah.
So when do you know to go to the doctor and get yourself checked out?
Yeah, I think if you have any of those symptoms, certainly that it's new. If you're elderly, if you have immunocompromised conditions, if you have any chronic illnesses, anytime you get those viral symptoms, we would like the patients to get checked out. And again, certainly because of information that's new every single day, we're trying to figure out how to manage those patients every single day, how to test them, how to quarantine them, etc. So it's an evolving issue, but I think anytime you feel sick, certainly go in and seek medical care.
And another thing, just to touch on what you said, it is evolving. So people need to pay attention, right? And what else would you urge people to do as it relates to coronavirus, as this is something, you said yourself, that we might see for a while?
Yeah, I think just try to calm down, to not panic, not overreact. Looking at the experts, they feel like this is not a significantly lethal sort of viral infection. It's not 100% mortality, more about 3% mortality. So most people who are healthy will just have flu-like symptoms. We still always talk about the ones that are immunocompromised, elderly, young. Those are the patients that really seem to have a problem with these new viruses. But most people, if they do have that infection, will be able to survive and move on. So I just want to try and calm fears about that, and we're on top of it. We have a system in place. This is the greatest country in the world, so we're going to take care of it and do the right thing for everybody.
All right. Well, Dr. Levine, thank you for your
Yes, sir.
expertise.
Yes, ma'am.
We appreciate it.